Hello. Okay, sorry. Hello. My name is Ileana Garcia, and I am here to inform you, Mr. Tompkins, because you can't make your own video, on what MS is. So, MS is multiple sclerosis, I think, yeah, which is a disease where the immune system eats the myelin that covers like the nerves, and it causes nerve impulses to be disrupted. So that like basically means that the nerve signals between the brain, spinal cord, and the like entire body is completely disrupted. And so multiple sclerosis, it is a disease that can cause a lot of different symptoms, such as like fatigue, vision loss, impaired coordination, and that's like just to name a few. But for some people, the pain or like severity of the disease or the symptoms can vary. So like certain people can go maybe like their whole lives without really feeling the symptoms like in a really like heavy level, I guess. Whereas other people go like through these every day and they can feel it like really bad. So like it impairs their walking or their speech. So like some people have noticeable symptoms and some people don't really have noticeable symptoms, but like they still have MS. So the main areas that are painfully um, affected by multiple sclerosis are in the back or the eyes because the like nerve signals from the brain to the spinal cord are the most disrupted in like some cases of MS. And I just pulled that out of my butt. So if I get that wrong, I'm sorry. I'm just thinking that's what it is. So people also commonly experience like emotional like mood swings or like anxiety, depression. So it's not just like a physical like there's not just physical symptoms. There's a lot of emotional symptoms as well. Um, but like majority of it is like dizziness or headaches or sleep deprivation, numbness, or like they're super weak in their body, so like it's hard to move like your arms or your legs or kind of like get up and exercising. That's difficult for a lot of people who struggle with MS. It's difficult for them to do. So yeah, that's just like some of the complications that patients go through, or patients, I guess you could say patients, people that have MS go through. So treatment for MS you can either partake in like physical therapy or medication that suppresses the immune system. So seeking treatment will ultimately help symptoms, and it can slow the progression of the disease down. So some of the medications that are used for people who have MS are like chemotherapy, anti-inflammatory, steroids, and a lot more. Like I'm not a doctor, so I don't know all the other ones, but that's like the ones that are most commonly used. Um, but a big part in getting like the most efficient treatment is knowing what specialist to go to. So if you don't really like understand fully what like the symptoms are, the symptoms mean and stuff like that, it would probably be more difficult to get the right treatment because you don't know really who to go to. So like if you are someone who has like mood swings or bad anxiety or like depression, I don't think it's really smart to go to a neurologist, whereas like you would probably go to a clinical psychologist. So people who struggle more with like physical things would go to neurologist or maybe like speech therapist. So I think understanding what your symptoms are and what they mean will help you ultimately get like the best treatment you can, because you can go to like the best like specialist because there's people who specialize in these things. So not just for like MS patients, but for anyone who goes through like diseases like this. And don't even know what half of the stuff that I just said. I feel like a doctor right now because that was really good. I know what I'm talking about. Please give me an A. And this was over 4 minutes by a lot. So goodbye. Peace and love. How do I exit?